Lower abdominal breathing is a foundational technique for voice production, but can be beneficial in many other practices to optimize your breath. Lower abdominal breathing is regularly taught as part of stress management breathing. It's often found in mindfulness, meditation, and yoga practices. It will benefit exercise endurance for athletic performance, and of course is crucial for adequate breath support for singers. From a health perspective, lower abdominal breathing can lower your stress levels, reduce your blood pressure, and regulate other important bodily processes. Let's talk about what happens in our body during respiration to understand why lower abdominal breathing is optimal. When we breathe in, our lungs expand and fill up with air. In order to make room for this, our rib cage expands outwardly and slightly upward, and our diaphragm drops. Our diaphragm is a cone-shaped internal muscle attached at the base of the ribs that separates our chest cavity from our abdominal cavity and is our main muscle for breathing. When our diaphragm drops, our abdomen has to expand to allow for its organs to move out of the way for lung expansion. When the lungs can expand fully, we can breathe deeper and achieve adequate oxygen exchange. When we limit the expansion, we call this a shallow breath, which can affect us in many ways and may negatively impact our voice. In this tutorial, you'll understand the difference between lower abdominal breathing, chest or thoracic breathing, and shoulder or clavicular breathing. You'll learn strategies to help reduce upper body tension and expand the rib cage and abdomen naturally, and apply lower abdominal breathing to voice and speech. These exercises will help teach you how to make sure you are breathing deeply and most efficiently. With this free tutorial, Resonate Voice and Speech Services encourages you to take notice of your breathing patterns throughout your day-to-day to feel or hear the difference in your voice when using lower abdominal breathing for speech. Lower abdominal breathing. So in the introduction to this video, you learned about the anatomy and physiology of why lower abdominal breathing is optimal for us. So now we're going to learn how to apply that. But first, I just want to go over the different levels that you might be noticing as we go about this tutorial. So the first one being the abdominal breath. So the lower abdominal breath being a belly breath, our abdomen expands and contracts on the exhale. So it expands on the inhale and contracts on the exhale. The thoracic breath, or the chest breath, the thorax is our chest cavity, is more of a chest breath. That sometimes you might hear about in yoga practices, but ideally our chest will expand a little bit in lower abdominal breathing, but we don't want it to be all in our chest, okay? So a lot of times when chest breathing occurs or thoracic breathing occurs, it can also cause the next level, which is clavicular breathing, or our shoulders, right? So if our clavicle, which is the collarbone, is going up, our shoulders are also going up. So that might look like, sometimes I see this when I tell someone to take a deep breath and they go like that, right? So pay attention as we're going through this. The clavicle and shoulder breath, of course, does this look tense or relaxed? Right? I look pretty tense. I would expect you to answer, right? So a tense breath like that can also contribute to muscle tension in our throat and neck, and can also impact the way that our voice comes out if it's not a relaxed and deeper breath. One of the things that I like to start with is using feedback. So you can watch yourself in the mirror while you practice these, or you can, for now, while you're watching me, you can take a hand on your chest and a hand on your belly, okay? So what's gonna happen is we are going to just use this to feel the movement or the shape change in our cavities. Okay, so here's lower abdominal breathing from the belly view. So we're looking at our belly And you're going to have your hand on your belly, and you're going to breathe in and out. From the side here, you'll notice I'm breathing in, I'm breathing out. In, out. So hopefully you can see how that shape changes as I'm standing to the side. So I want you to start by just finding a nice relaxed breath. So you can do this with your eyes closed if that feels comfortable for you, to really get yourself into a place where you're not thinking about your breathing. I want you to think about relaxing your upper body, relaxing your belly. We're taught to kind of suck in our belly sometimes, societally speaking, but I want you to think about really letting your belly hang loose, okay? That's really important for this. So we're going to find that happy place, whether we're at the beach, laying in the sun, maybe you are lying in bed before you go to sleep, or watching your favorite TV show. But I want you to take a few minutes, and you can pause this video as needed, and I want you to just feel with your hands where you are feeling that shape change, and notice what happens in your natural breath. Excellent. So if you are feeling more of that abdominal movement, which you hopefully should be, you can practice deepening that breath little by little to see if you can take a deeper breath, just expanding the lower abdomen, relaxing the upper body. If you're having trouble finding that deeper breath, we're going to do another exercise that can help us really feel the natural release of the abdomen when we need to breathe in. So I like to call this the 3-second pause exercise. So I will demonstrate this for you after I explain the exercise. So the first thing we're going to do is blow all of our air out as much as we can until we can't breathe out anymore. Disclaimer for asthmatics, be careful with this. Don't feel like you have to push to cough. I want you to just be really easy with yourself during this exercise, or skip it altogether. But if you feel comfortable to do this exercise, let's try it. So we're going to push out all of our air gently till we can't breathe out anymore. We're going to pause on the exhale for 3 seconds, okay? And then we're going to allow our body to naturally inhale, feeling the abdominal release. So the goal of this is to really keep our upper body relaxed and our lower body totally relaxed, so that you feel the expansion of your belly. And as you're doing this, we want to think about not allowing ourselves to start there and then go into the chest breath. So you might feel yourself expand in the belly and then go up into the chest breath. So we don't want this upper body movement where we actually get a paradoxical breathing pattern where the belly goes and sucks in a little bit as we raise our upper body. So just pay attention to that as you're practicing this. So let me demonstrate for you. Okay, so there was 2 in a row, so you can do a couple in a row. And then once you feel like you get a good handle on your lower abdominal breath, you can start to actually go into a natural lower abdominal breathing pattern. Something important to mention is that you can try these exercises as well on your back. Some people like to put a book or something flat on your belly so that you can actually see the rise and fall of your belly. When we're laying down, we don't have to support our upper body, and it can be a little easier to feel this lower abdominal movement and to practice. So if it's easier for you to start there, by all means, start by laying on the ground or a flat surface and try that. It's very important that we practice this exercise a lot throughout your day. So anytime that you feel you are sitting and not really doing a whole lot, whether you're in class or whether you're at work or sitting at your computer desk, maybe you're on the drive at a red light, or maybe you're sitting at the dinner table quietly, you can do a little bit of this practice where you're just thinking about your lower abdominal breathing. It's something that you can do publicly and frequently to get it automatic. So let's apply this lower abdominal breath, now that we have a good handle on it, to the voice. So we want to take that nice lower abdominal breath in, and then we're going to hum. So I'm going to put my hands on my chest and abdomen just to feel this. There it was. So I hummed and I used that breath, and I felt my belly going in as my breath and voice were coming out. Now, let's try it with speech. Hello, how are you today? You might notice that taking a conscious breath changes your voice quality. You might feel a deeper sense of breath or a longer sentence duration. There are lots of benefits to using lower abdominal breathing with speech. So practice this, try it, and start to think about your breathing every day so that you can start to change those habits and improve your voice.